Hi, I'm Dr. Jayanth here. I'm a Cleft surgeon and I take pride in representing ABMSs. Now, cleft lip and palate children can be born with nearly 200 plus syndromes, and it is very important and essential that we identify these syndromes so that the comorbid or the coexisting issues connected to the heart or the neurological system or the renal system can be identified so that we can prevent any untoward effects during the surgery, to prevent any complications during the surgical care that we are going to render later on. Along with this, the neonatologist will evaluate the child with regards to swallowing and the feeding mechanisms so as to ensure that we are going to have the child feed and therefore be in good nutritional status when the child later on comes to surgery. And for this, we deliver special nutritional aids like feeding bottles, top up nutritional supplements if required if the mother's milk is not sufficient, and also train the mothers in ensuring that the feeding is delivered by a combination of the mother expressing her milk or the child learning to latch onto the breast and suckle appropriately, since most of these small toddlers don't have the ability to suck breast milk directly. So we emphasize a lot on the nutritional aspect and ensure that the child puts on adequate weight, and therefore the nutrition is addressed so that the post-operative healing is optimized. And from here on, at the age of 3 months, we take up the child for the lip surgery. And once the lip surgery is done, most of the parents and their family members are very happy that the child looks quite normal externally. And from here on, over a period of the next 6 months with regular visits, we again ensure appropriate nutrition so that the child comes on to us at the right time for the next surgery, which is the palatal surgery, to close the palate physically and also to ensure that the speech muscles are reoriented and operated accordingly to have the best outcome in terms of the speech. Now, beyond this, our team again gets involved, and our speech therapists, our ENT doctors, we have a very regular appraisal of the child between the age of 1 year and 4 years to ensure that speech outcomes are great by regular speech therapy or speech stimulation. And we have to assess the otology and the audiological aspect of it, since after the palate closure, a few of the kids can develop middle ear infection which can reduce their hearing. And to ensure the best outcomes following palatoplasty, we focus on speech and on an annual basis do the audiological checkup or the otology part of it.